Today, the United States faces more challenges than ever. Topping the list of concerns, the search for alternative fuels, a slumping economy, and the need for better health care for all Americans.
It is vitally important in the United States to maintain a quality health care system as our population ages. As you're aware, there are more and more seniors diagnosed on a daily basis with advanced medical conditions, all of which require rather intricate treatments.
Every hospital and medical center in the country opens its doors with the mission of providing safe and sufficient medical care to each patient treated. But due to a nationwide shortage of registered nurses, each year tens of thousands of patients end up lacking the most basic care needed.
Unfortunately, at a time when there's an ever-increasing need for healthcare professionals because of the aging population, there's a shortage of people entering the healthcare industry.
Most of our young college graduates are finding other things to do, less demanding things. The age of our population has made nursing a much more difficult job, and most people find other avenues of employment. Additionally, many nurses have retired. They're not being replaced by young nurses, and many of our best nurses have gone on to advanced level nursing, be that nurse practitioner, nurse anesthetist, or physician assistants.
Reports say there are over 150,000 unfilled nursing positions nationwide. These understaffed hospitals have the potential to evolve into stressful working environments for nurses, threatening the delivery of quality health care. Overworked and exhausted nurses are vulnerable to making mistakes, increasing the odds for complications and patient mortality.
Conditions working in an understaffed hospital are really difficult for the nurse because they can't give the patients the type of care that they need. And it can also be detrimental to the patient because their nurses are overworked and there's not the ancillary staff to assist the nurses in delivering patient care.
Anytime there's a lack of nurses on staff, there's a potential for errors to be made. Probably the most common one being medication errors. Some of them might be simple, some of them might be life-threatening. On top of that, you have one nurse taking care of more patients than ever. That results in a delay in treatment. Someone presses a call bell, nobody comes. It's a tremendous problem.
Hospitals and care facilities that have had difficulty recruiting and hiring permanent staff members are finding that travel nurses are a potential solution to this critical shortage. Travel nurses are filling the gaps, allowing hospitals to continue to fill beds without undermining the quality of health care that is delivered to each patient.
Hospitals are able to pick up the phone and call a staffing agency for whatever type of healthcare professional they have a need for. It could be that a staff nurse is out on maternity leave, or patient census has increased, or the hospital has expanded and they need nurses to come in and hit the ground running.
Well, the hospital's ability to utilize a travel nurse has helped decrease the shortage. There are nurses that are available, well-trained, willing to travel, willing to work on 13-week assignments that help take the weight off some of the nurses that are there full-time, that are fatigued, that are overworked, and that perhaps are making errors.
Strategic Healthcare Staffing Incorporated values the leadership, humanity, and unique skill set nurses bring to the healthcare industry. Responding to the nation's critical shortage of nurses, Strategic Healthcare Staffing is dedicated to recruiting and placing registered nurses in acute care settings throughout the country.
I believe that I could create a model that would help hospitals receive the staff that they need, help nurses better their lives, give them the opportunity to travel around the country, and give recruiters and entrepreneurs around the country an opportunity to better their lives and own their own business and work from home.
Registered nurses recruited by Strategic Healthcare Staffing enjoy lucrative opportunities to learn exciting new techniques and expand their skills. They work alongside seasoned professionals at some of the most prestigious medical facilities in the world.
Some of the benefits for the healthcare professional is to learn new techniques, learn new procedures from different places. There's tax benefits, there's paid travel, paid medical and dental benefits day one.
I've gotten to work in numerous different ICUs that I never would have been able to work at had I not started traveling. I've gotten to experience a lot of different patients that I never would have seen had I not been able to travel. And I've been compensated very well for it.
Constantly working to fill the thousands of travel nursing positions available across the country, Strategic Healthcare Staffing Incorporated has developed a unique work-at-home business opportunity for people to work as independent recruiters. Recruiters partnering with Strategic Healthcare Staffing are trained to utilize numerous marketing methods to fill the nursing voids in the healthcare system while earning a significant profit.
Strategic Healthcare Staffing has developed a branch recruiter program which allows entrepreneurs and existing recruiters an opportunity to work for themselves from home or open up their own office.
You don't have to have experience in healthcare or recruiting. With our great system for training, we can train anybody to be successful.
Being a travel nurse can be stressful because there's a lot of different aspects of the contracts that you have to figure out, the job itself, the housing where you're going to live and how you're going to get there. Strategic really made it easy to travel. They helped us along with housing, finding the physicians that we needed.
If you are a registered nurse looking for a new challenge or an entrepreneur looking for a promising opportunity, contact Strategic Healthcare Staffing Incorporated.